Let's now switch topics and talk about the surgical procedures. Let's start our discussion with the sleeve gastrectomy. The sleeve gastrectomy is performed via minimal invasive techniques. That means tiny little holes in the abdomen. We insufflate the abdomen with a gas that enables us to visualize the stomach. So what we do is that we change the stomach from the natural form that can contain up to 2-3 liters of food, and now we make it a smaller stomach, almost the size of a banana. So most patients after a procedure are able to eat almost a little bit of everything, but the stomach capacity is limited to anywhere between 3 and 8 ounces of food. Let me show you a quick demonstration of how the sleeve gastrectomy procedure works. So we place small ports, which are the size of a pencil, in the abdomen under direct visualization with the special cameras. This enables us to place specialized instruments to complete the procedure. As you can see, the stomach, intestines, normally the food goes down into a large container of the stomach that can hold up 2-3 liters of food. The purpose of the sleeve gastrectomy is to reduce the portion and the hunger feeling of the patient. We do that by cutting a portion of the stomach that could be in the range of 80-85%, and now the new stomach is smaller, almost the size of a banana. We do test the freshly cut stomach to make sure that there's no leakage or anything like that that could cause a problem or complication. By the time the patient finishes the surgery, we have already performed at least 2 or 3 quality checks to make sure that the patient is going to be okay after the procedure. As you can see from the video, the sleeve gastrectomy surgery is very well tolerated and performed in a range of 1 hour to 1 hour and 30 minutes depending on the patient. As with any therapy for weight loss, you need to adhere to the dietary recommendations by the specialist, including an exercise regime. Please understand that bariatric surgery is a lifelong commitment. That means that you're followed by your specialist at a 1 to 2 weeks interval after the procedure, a month, 6 weeks, 3 months, 6 months, a year, and every year thereafter. During those routine checkups, what we do is that we check the nutritional panels, including problems with vitamins, and we correct them as we find them. A good thing is that the sleeve gastrectomy, by definition, is not a malabsorptive procedure, so the chances that you can have problems with vitamin deficiencies is extremely low. That being said, because the patient is now ingesting a small amount of food, it is required and recommended to increase the amounts of nutrients and vitamins that they ingest. Also understand that the sleeve gastrectomy is a permanent, non-reversible procedure. But should it need to be corrected, we have other options to solve patients that have problems or symptoms. The main advantage of the sleeve gastrectomy is that the procedure is performed only in the stomach. So as the patient eats, the food follows the normal pathway of the intestines. Even though it is a permanent alteration of the stomach, it does not change your anatomy or the way that the food travels through the intestines. Disadvantages of the sleeve gastrectomy may involve having problems with gastroesophageal reflux disease on the long term, and this is more true for patients that suffer from gastroesophageal reflux disease before the procedure, but also risks complications, including bleedings or any breakdown where we cut the stomach. Fortunately, the risk of any problems happening after a sleeve gastrectomy is less than 1% altogether. The ideal candidate for the sleeve gastrectomy is a patient suffering from morbid obesity, defined by a body mass index above 40, or patient that has severe obesity problems, defined by a body mass index above 30 or 35, and also live with a medical condition associated to the weight, such as diabetes, sleep apnea, high blood pressure. Most patients with a sleeve gastrectomy expect to lose anywhere between 60 and 75% of the excess weight loss. So before the surgery, there's a preparation that involves investigation of the stomach so that we can tell how the stomach looks before the procedure. After the procedure, we go into the natural progression of the diet, including a liquid diet for 2 weeks after the procedure that we progressively advance into a more soft consistency. Most patients are able to go home the next day or 2 days after the procedure. It is performed in the hospital, but it is very well tolerated with minimal pain. After the surgery and the patient goes home, most patients are able to resume normal activities, including work-related activities, within 5 days to a week. By the time people come back for their first follow-up, which is 1 or 2 weeks after the procedure, they have lost anywhere between 10 and 24 pounds. One of the main advantages of the sleeve gastrectomy is the ability of the patient to maintain the weight loss on the long term. That being said, it requires the patient to have appropriate follow-ups and is sticking to the recommendations of the specialist. The sleeve gastrectomy is covered by the insurance, but you need to meet certain criteria, and also your policy has to have coverage for obesity. Not all insurance policies do have coverage for obesity, especially in the state of Florida. For those patients that don't have insurance coverage, we do offer very affordable, safe, self-pay prices. The cost of a sleeve gastrectomy may range anywhere between $8,000 and $22,000. Luckily, we have one of the most affordable programs in the nation.